Assalamualaikum and a very good morning. My name is Norasyikin Binti Rumidi. Have you ever felt uncomfortable on your skin? Like feeling itchy until you are emotional for the whole day? Imagine that this comfort feelings you are going on through on your life and it cannot be changed unless you get an appropriate treatment just because of this one disease, what we call as atopic eczema. In addition, atopic eczema is also called atopic dermatitis. So today, I'll be sharing about the topic of skin allergy, which is eczema, and at the same time, I would like to inform my audience about atopic eczema awareness. Why I became interested to discuss this topic, it is because I have my nephew and also my friends who is suffering from this eczema since a baby, and until now they have a lot of experience to share as a child with eczema since a baby. So here I want to help them by giving awareness to all people out there that eczema is not a normal skin allergy, but this is a chronic itchy inflammatory skin disease and needs to give intensive care. Atopic eczema or atopic dermatitis is term used to describe skin inflammation. Atopic eczema is a chronic inflammatory skin condition that can cause an itchy red rash in skin creases such as folds of the elbows or behind the knees. Atopic eczema is not contagious, which is you cannot get eczema from a person or give it to another person. In fact, there is an appropriate treatment to reduce this eczema that I will explain more later. Usually, people who are prone to eczema are starting from the age of 5 years and below. So here, there are some causes and appropriate treatment of eczema that I will explain later. The cause of eczema is by genetic factors, and the appropriate treatments are by applying the medication and making a phototherapy or light UV treatment. Atopic eczema is a chronic itchy inflammatory skin disease that most happen in those below 5 years of age, and it is a common developing country in Malaysia. The prevalence of atopic eczema amongst patients went to the dermatology clinic of the National University Malaysia was around 3.7%. According to the prevalence of atopic dermatitis by check the prevalence among 5 to 7 years age group children was 13.7% and 12 to 14 age group was 9.9%. The prevalence rate of eczema symptoms among primary school children was 17.6% and 30% among secondary school, and last but not least 8.2 students among university. According to the finding of this study, atopic dermatitis is the most common disease seen in young children aged 5 to 7 years as well as adults and adolescents, and the highest percentage are among primary school. So let's jump to the causes of eczema. First, foremost, by genetics. Various studies have shown that it is caused by genetic. It is because they have an abnormal immune response, which is their abnormal protein and lipid contained in the skin upper layer affect the skin barrier, and this leads to skin inflammation. For you guys' information, there is an FLG gene that instructs cell to make a large protein called fligrein in the outside of epidermis, and then epidermis is actually responsible to maintain the skin barrier function. Moreover, a healthy skin barrier is able to retain moisture. Other than that, it protects our bodies from bacteria and toxins. Therefore, due to this issue of genetics who suffering from this atopic eczema, it happens when FGV gene has mutation in its DNA that can cause to instruct less cell to make less flaring. Normal skin has large flaring, but in the atopic of eczema cases, there has less flaring. So it can affect the epidermis, which is it can lead to dryness, which is prone to infection and allergy, and it becomes eczema. Until now, there is no medicine that can cure atopic eczema completely, but skin conditions can be treated and controlled with proper skin care and use the appropriate medication. Generally, atopic eczema will get better as the age of the child increases. However, according to my research, around 40% of eczema patients during childhood will continue until adults. Like my nephew and my friend were still struggling and fighting with eczema until now. The first treatment is by applying medication. As an example, pimecrolimus cream, or we just can call it Elidel. This is cream. It is a steroid-free medication used to treat atopic eczema and also other inflammatory skin condition. They can apply to affected skin or the face, head, wrists, and other areas that can prone to eczema. In addition, it also can reduce the itching. Next, we also can make some therapies to treat atopic eczema. For example, phototherapy or ultraviolet UV lighting. It may be suggested for severe eczema. Furthermore, this phototherapy involves in control the exposure to UVA or UVB rays for a few minutes and will be done 2 to 3 times per week. Moreover, this phototherapy treatment may continue for several months. So, I suggest the government provide enough treatment or take some prevention before a person gets atopic eczema. Prevention is better than cure. For example, I recommend government to provide the vaccination for atopic eczema started from age 5 and below. This is because according to the findings of this study, atopic dermatitis is the most common disease seen in young children below 5 years old. However, the dermatologist should be concerned about the ingredients used in the vaccination, because someone who already has sign of atopic eczema, they are allergic to the medication sometimes. So to conclude, this atopic dermatitis, or we can call it as atopic eczema, needs to create more awareness to all people out there that this disease should not be taken lightly in the future. It is because some people thought that this atopic dermatitis is like a normal skin allergy, but it's actually a chronic itchy inflammatory skin disease. Moreover, if you have a symptom of eczema, please seek the doctor immediately for more details. That's all from me. Thank you.